Good morning, my wonderful listeners. My name is David Oluwafemi. Welcome to class today. The topic for today is drug abuse. Drug abuse. Our learning activities, our learning objectives are: you should be able to define drug abuse, list dangers of drug abuse and effects of drug abuse. What is drug? A drug is any substance or chemical that changes the way a person works when it is absorbed into the body. Any substance or chemical that changes the way a person's body works when it is absorbed into the body. Then what is it? Drug abuse. What is drug abuse? Drug abuse is continued unnecessary use of drugs. Excessive or continuous use of drugs, especially without regard for accepted medical practice, without prescription, no medical advice, no doctor's instruction for you to use a drug. That is drug abuse. When a drug is used to incite pleasure or escape reality, especially without doctor's prescription, it is called abuse, drug abuse. Once again, when a drug is used to incite pleasure or escape reality, especially without doctor's prescription, it is said to be abused. You are abusing the drug when you are not instructed by a doctor. Now, let's see some commonly abused drugs or substances. Cocaine, marijuana, heroin, even paracetamol. You wonder, paracetamol again? Yes. A lot of us take paracetamol just for pleasure, without instruction, without medical instruction, without medical prescription. And the instruction is, if the headache persists, see your doctor. We take paracetamol consistently without doctor's instruction, even contrary to the instruction given. We do not see doctors. That is drug abuse. And there are effects to that. There are light effects. There are adverse effects. The light effect of drug abuse is that the drug and substance abuse has some immediate thing like lightheadedness. You just realize you just feel dizzy, stomach upset, skin rashes, injection abscesses, those that use injection, and so on. But there are some more chronic effects like fatigue, depression, anxiety, and dependence after drug effect has worn out. Dependence on drug, you just cannot do without the drug because you're attached to it. That is addiction. Get to the point of addiction, and when it gets to addiction, you become more adverse in its effect. Still another adverse effect causes loss of focus. Somebody that is addicted to drug or has abused drug they lose focus easily. There are increased rate of accident. Why? When people ought to rest, they want to drive, they go on drug, and because of loss of focus, there are wrong judgment in driving, and it causes accidents, and rate of accident increases with more use, with more abuse of drugs. There are terrifying illusion and hallucination. So many times people who are on drugs, who are abuse drugs, they hallucinate, they see what is not real, and some of those things that you see are actually terrifying. Terrifying, like why do you where you see that, and it also causes high risk of contacting diseases. You share injections to inject yourself when you smoke cigarettes, and so on. It increases the risk of contacting diseases. It can lead to coma. Somebody can go in coma. Why? The brain is affected. It affects the brain directly and adversely. So it can cause coma. People who are on drugs and have abused drugs, they are violent. They're violent. And there are several psychological effects too. Alright? The psychological state is unhealthy. Now, what are the few causes of drug abuse? So many things cause drug abuse for people. Many people go into drug abuse for many reasons. But one of the few of them is that some of them go there because of failure in examination. Failure in examination. Some go there because of peer pressure. Their friends is doing it, they want to do it too. Some go there because of illegal relationship or depression. They feel depressed and they want to get out of the depression. They go into drug abuse. Some curiosity or experimentation. What is this not about? And let me test it. Why should you test it? Why? It's wrong. Don't go into drug abuse. There are several other causes why people go into drug abuse, but these are few ones that is caused in this class. Now, how do we prevent it? How do we control drug abuse? One, let's say this: learn to deal with your life, pressures. When pressure comes, when failure of examination comes, that is not end of life, for God's sake. So learn to deal with it. Tell yourself, I will pass again. I will try it again. To fail once does not mean I'm a failure. I'm not a failure. Don't give in to peer pressure. Friends want you to do it. Then excuse me. I have my mind. Talk to them. Excuse me. Don't push me around. Alright? And don't follow bad guns. Develop good family ties. Be close to your family. Don't be secluded. Alright? Relate with them. Rejoice with them. Move with them. And develop healthy habits. Develop healthy habits. When you want to sleep, sleep. Your body wants to sleep, sleep. Don't use drugs to make yourself to be awake. And when you have to work, work. Okay? Now, we've learned so many things this morning, and I want us to go through it again. I'd like you to define drug. What is drug? How do you define drug abuse? How can it be corrected or controlled? Once again, what is drug? What is drug abuse? And how can it be corrected or controlled? Okay. Thank you for listening, and do enjoy the rest of the day. Bye.